If you've been dealing with nagging hip pain, the kind that makes you limp after a long walk, keeps you from laying on your side, or makes you feel like you've aged 10 years just from getting up and out of a chair, well, you've probably tried a lot of things to fix it. You've likely done the standard PT where you go in, they give you a generic sheet of stretches, or maybe you've done chiropractic, you get that pop, you've even done an injection, and these things can help, but oftentimes the pain comes roaring back. The reason that these fixes fail is that they treat the symptoms and they don't treat your whole system. So today I'm going to explain why your hip often is actually a low back issue in disguise and why your stable joints are functionally weak. The exact process that we use at Shield PT to get active adults back to lifting, running, and playing with their kids without their pain blowing up for days afterwards. So to help you understand why your hip hurts, we want to look deeper at the muscles in the hip called the deep hip rotators. So they sit underneath your glutes, like basically in your back pocket. The one that you know is probably called the piriformis. Most people have heard of that one. There's also the obturator internus and externus, the gemellus brothers, but they all work together, and their main job is to stabilize the hip. So when they're working, you don't even think about it. They hold everything in position. Your hip is great. When they don't work, however, then you know it. And your hip pain loses its centering. It leads to that deep ache right in the buttocks. Oftentimes you'll get a sharp pain in the front. But here's the critical link. The nerves, so let's talk through this. The nerves that tell these muscles, they live right here, to work, they come out of your low back. And so any disruption to those nerve signals, even if you don't have pain in your back, there could be pressure there. There could actually be pressure not in your back, but kind of in the intersection between your back and your hip. But it creates a fuzzy signal going to those muscles. And so then you become functionally weak. Sometimes they're strong, sometimes they're weak, but they're not strong all the time. And so you can do all the exercises in the world to strengthen your glutes, to strengthen the outside of your hip, to do clamshells and RDLs and all these things. But if you're not getting a good signal to those muscles, then the stabilizers will never be strong enough to protect your joint. This is why so many people get stuck in a cycle of temporary relief. Is like they feel good because they've worked the muscles, but they never solved the original issue of getting those nerves sending free signals. And that's what keeps you from having a flare up. So evaluating your own hip is really hard. Ask me how I know. Until you know exactly where you're deficient, you don't have a problem. You don't have a plan to solve the problem. You can find exercises online or do the ones that a previous therapist gave you, but without knowing the right time, the right intensity, oftentimes it feels like you're just spinning your wheels. I was a doctor of physical therapy and an athletic trainer already. I knew all the exercises. I worked with 2 other PTs who were really good clinicians, but they didn't give me anything that helped very much, to be honest. So for 2 years, I struggled with my own hip pain because these assessments that they were doing, that I was doing, weren't in depth enough to find the root cause. I was doing good exercises, but they weren't the right exercises for my specific deficiencies. So I don't want you to waste 2 years or more like I did. So that's what I want to tell you about. At Shield PT, we utilize a framework called the START, Strengthen, Shield. It's our 3-step process. It begins with the most comprehensive evaluation likely you've ever had of your hip, where we don't just look at where it hurts. We're going to look, like I said, at your system. So we start from top to bottom, and then we look specifically at 6 directions of motion, both in your back and in each hip. And so what does that look like? We're looking for asymmetries, but your back should be able to twist both directions, should be able to side bend both directions, and of course it bends forward and backwards as well. And so we're looking for the same thing in your hip. Hip should be able to rotate in and out both directions. You should be able to flex and extend, and then you should be able to what's called abduct and adduct, where the leg is going in and out. So as we look at all those motions and we break them apart, we compare your flexibility, we compare your strength, left versus right. Is one side significantly stiffer or weaker than the other side? That's a problem. Pain is almost always correlated with these imbalances. Clinical signs of arthritis, we're going to be looking for that too, because we want to determine if this joint is truly damaged so much that we're not going to be able to make progress, Or is there just something else like your muscles or your capsule, the ligaments of your joint that keep it from moving correctly? And then we want to look at that signal quality I was talking about. We want to check if your low back is interfering with your hip stability. So our goal in phase 1 of the start phase is to get you moving pain-free by eliminating all of those asymmetries. And then once we find the deficiencies, we create a crystal clear plan where we're no longer guessing. Since my own struggle, I've specialized in this connection because how I treat the low back and hip is one unit. And I've been able to compress the recovery times in my clients significantly. Most people come to me because their world has compressed. They have low energy, they aren't sleeping well, they've stopped hiking, they avoid exercises, and ultimately they just stop doing things because it risks flaring up their issue and it's not worth it. Many times they've been told, oh, you didn't have success with physical therapy and chiropractic, now you have injections and medications forever, or do surgery. And who likes those options? But in about 3 months, we take these same people that are left with these only 2 options, and we get them to a state where they're going on long walks and hikes. They don't have that limp anymore. They're lifting weights, playing with their kids and grandkids, sitting and sleeping without that constant nagging discomfort. We have a 90+% success rate, even with people who have failed traditional physical therapy and chiropractic in the past, because on our very first visit, we can tell you, yes, we can help you, or let's push you towards someone else that specializes in something else. And if you make it past that first visit, I feel very confident that we're going to be able to help you. Now, I have to be direct about who we help. Now, I have to be direct about who we work with. Our Start, Strengthen, Shield system is designed for people who value their health and want to be active. It's not for people who are unmotivated or looking for a passive fix where you can just lie on a table and have someone work on you. If you're not willing to put in the active work to reclaim your movement, well, then we're not the right people for you. Our system won't work. I don't want to waste your time. However, if you're a runner, a hiker, a busy professional, or a grandparent who refuses to let pain dictate their life, then you're exactly who we're looking for. Stop managing the pain and start solving the cause. Click the link below to schedule a free discovery call where we can talk through your goals, look at your history, see if our framework is the right path to get you back to the things that you love. To be honest with you, if we can't help, we won't tell you that we will, but if we can help, we'll start with that evaluation and give you a plan to get you back to the things that you want to do without this nagging pain. Whether it's your back, whether it's your hip, whether it's a combination of all of them, I think we're best suited to be able to help you. If you live in Fort Wayne, it's easy. Come in and see me in the office. If you don't live in Fort Wayne, hey, we have virtual options. It's mostly it's a movement evaluation anyway. And so I can watch your movement through a call, see how you move, prescribe you the exercises that you need, and we can still help you even if you can't come to the area. So hopefully this is encouraging. Hopefully this helps you realize that your pain is not a life sentence, even if you haven't had success with the other treatments in the past. If you want to, read our reviews, really good reviews. Most of them, like I said, have failed PT in the past. And so hopefully that's an encouragement to you, and I will talk to you soon.